9-year-old Rose Nasimiu captivated the Kenyan audience with her confidence and witty intelligence, despite the fact that her tender body is fighting a type of cancer known as Hodgkin's lymphoma, a cancer of the lymph tissue found in the lymph nodes, spleen, liver, bone marrow, and other sites.
Writing, drawing, all those are my hobbies. Yeah. And I also like modeling.
Instead of retreating into her little cocoon and let life take its toll, Rose captured Kenyans with her brevity in tackling the disease head-on by attending TV and radio shows, print interviews, and even giving talks at events on cancer. 4 months after she was diagnosed with cancer, Rose has to go through courses of chemotherapy every fortnight, totaling to 16 courses. A financial nightmare for her parents, who have to spend 50 to 60,000 shillings for every session. To help raise funds for her treatment, Rose has written a song, I Believe, and for her to get treatment for one chemo session, she would have to sell 120 copies of her music. Unlike Rose, not many children are in a position to sell music to raise funds for their treatment. A Human Rights Watch report released last year found that most Kenyan children with diseases such as cancer or HIV and AIDS are unable to get palliative care or pain medicines.
No. If I press, it should just go back.
To address this, the German Development Corporation, through GIZ, embarked on a mission to find out how much it may cost to provide palliative care in the country. GIZ has commissioned a renowned health economist from Seoul, South Korea, to conduct a costing study on palliative care in Kenya.
Palliative care for children in Kenya is not well established. So the information we get about the cost of those providing those services is very limited. We found that the cost of providing palliative care to children per month is in the range of from the low estimate of about $50 per month per children to some high estimate can be like $150 per month per children. Huge financial barrier for the children to access to these very important services.
Indeed, the government has realized this and has established palliative care units in some government hospitals.
I've learned that government already made some commitment to establish a palliative care unit in about 11 public provincial or district hospitals. It's a good start, and I'm glad to see that government has some commitment to do something in this area. But it's just a start. I mean, government should allocate enough resources, enough budget.
Professor Korn mentions that Kenya is particularly challenged in proper data management of cancer.
To have a accurate costing and accurate estimate of how many children need this type of services, government should have a good information system. For example, for cancer patients, Kenya does not have a good cancer registration system.
The professor reckons that lessons can be drawn from neighboring country Uganda, which employs a community-based palliative care approach.
Health workers visit those children at home who need care. So there are a lot of positive performance in terms of cost, in terms of satisfaction.
According to the professor, a starting point to improve the situation in Kenya would be to remove the legal barriers to accessing morphine.
We need some discussions about whether nurses should be allowed to prescribe morphines, because in some areas where doctors are not available, probably we may want to allow nurses with some training.
A good regulatory and monitoring system on palliative care, including palliative and hospice care into the education curriculum, and creating better public awareness on palliative care are other ways in which the government can ensure that children in acute and chronic pain do not need to suffer needlessly.
So from economics perspective, there are many patients who stay in hospitals for a long time, but they actually do not need to stay there. So if we encourage them to utilize palliative care or hospice service instead of those extended stay in acute care hospitals, then from a broader social perspective, we can also reduce the healthcare expenditure.
The results of Professor Korn's study are expected to be out by mid-September, and his recommendations are expected to inform policy on financing and costing of palliative care. GIZ has partnered with the government for several years on healthcare financing to improve access to affordable quality healthcare. It is interventions such as these that will help many children in Kenya live longer and fulfill ambitions, like that of being a pediatric oncologist for Rose Nasimiyu.